Bill, thank you so much for joining us. When the murder first happened, and obviously it was a horrible crime, but every article that was posted about the United Healthcare CEO, Brian Thompson, I mean, you could look at every comment below the news article, and they were very unsympathetic towards the crime. And, it's basically kind of a description of kind of what has been happening, the frustration towards the healthcare industry. Talk a little bit about that and why people in general, Americans, are so frustrated with what has been happening with healthcare.
Well, I want to separate it. Healthcare is just fine. Doctors and nurses are very caring people. What's wrong is healthcare purchasing. Let's add the word purchasing. And to purchasing, the cost is hidden by both the hospitals and the companies such as United Healthcare. You don't know what the price of care is before the time of care or after the time of care. In US of A full 20% of claims are denied first time. You get care, one in five of you has a denied claim. You're paying 30,000 for a family of four. You're thinking they should be really bending over backwards to help you as the customer. Meanwhile, United is colluding with a hospital, making sure your costs go up every single year, and that creates a lot of anger.
And what I was reading about, and you'll probably know more than I would, that Brian Thompson was part of this new kind of AI system that was installed at United Healthcare that was denying claims. I mean, this AI system was literally put in place to deny claims. Is that true? And then also, I mean, that obviously has to create more anger. And also, I was reading too that it wasn't really even working. There were flaws within this AI program.
Oh, I don't know if you want to call them flaws. It's designed to work the way it's working for United, on pace for 450 billion in revenue.
Wow.
The slogan is profits over patience. Period. So I have heard multiple times, but I don't have hard evidence of AI being used to deny claims. But boy, oh boy, do I have examples of United Healthcare not giving larger companies their claims data. If you go to a restaurant and you eat and you drink, that's your bill. If you consume healthcare as a large employer, those are your bills. United Healthcare says, no, those are proprietary. We're not going to give them to you. You just have to keep paying. And that's illegal, but they have viewed the illegal return on investment higher than being legal and caring.
Do you think this crime would be a wake-up call at all to the healthcare insurance industry? I mean, at all. I know that, that there was this story about how anesthesia would not be covered with a new company for the entire procedure. And that obviously that they kind of read the room and said, well, maybe we should, cover the whole anesthesia for that entire procedure if someone is on the operating table. And they decided, no, we needed to cover that. But do you feel like there might be any kind of change in the healthcare industry because of what has happened? Or do you feel like, no, this is kind of par for the course?
I think it is indeed a tipping point. How much more can we pay? 30,000 for a family of four, plus a $6,000 deductible for the average family to access 3,000 of care. So you're paying $33,000 for 3,000 of care, and you're angry because no one's giving you customer service. Instead, you're paying them to financially torture you. It is a tipping point. So when Anthem Blue Cross Blue Shield says we're not going to pay for anesthesia, but for maybe half hour, and after that, we're just not going to pay the doctors. We do have a bit of twisted sister. We're not going to take it anymore going on, and that's what we need.
What would you recommend to folks who are just kind of listening to our discussion here? What do you tell folks who are paying attention and want change to happen within the healthcare industry?
Well, there's multiple. If you're the patient, the purchaser of care, number one, don't go to the hospital unless you need hospitalized. If you can use a freestanding lab like Quest or freestanding imaging center not owned by a hospital, you're going to pay a half to a third. Second, if you need the hospital, call. It's homework. Call, get the cash price if you have insurance, then second, ask for the insurance price and get it emailed to you. You want the first and last name of who you speak with. After you get a bill, it's not going to be itemized. No bill is itemized in the country by a hospital. It's on purpose. Ask for an itemized bill, which is a big way of saying, I want the name of every care item spelled out with the money number you expect me to pay right next to it before I will consider paying this bill. Until then, my bill is in dispute because you hid it from me. I haven't seen the real one. And then you'll see double billing, things that they said they did that they didn't do for you. That's helpful. We should consider an HSA, health savings account, pay for your health with pre-tax instead of post-tax dollars. And if you're making between 30 to 75 grand, 100 million Americans qualify for free or discounted care under the Affordable Care Act. Always ask if the bill's 2 grand or more, ask to speak with the financial counselor of the hospital before you even pay your bill, even before you pay the high deductible.
Okay. Great information. Dr. Bill Hennessey, thank you so much. Yeah, really, I'm sure we could talk a lot more about this, but thank you again for your perspective. Really appreciate it.
You're welcome.
Okay.